Of course, we're getting together with our friends. Now, you may have noticed when you were there, maybe some people were still coughing, a little bit sniffly, sneezy. The thing is that COVID, flu, RSV, we talk about that a lot around the holidays, but it's still very prevalent in our communities, and it's still something that we're seeing case numbers above average for. So we spoke with a doctor here in Arizona from Blue Cross Blue Shield of Arizona, just about the trends that we're seeing in our communities. And of course, even as we head into March, starting to head into spring, how you can keep yourself and your loved ones safe.
Number one way people can stay safe from influenza or respiratory virus is being vaccinated. So going and getting your flu vaccine, which is recommended for everybody 6 months and older, and getting your RSV vaccine, which is recommended for pregnant women and for people who are over 60 in consultation with their provider.
So when it comes to some of the trends, are we seeing more cases this year compared to previous years? And do you think there's anything that's kind of contributing to those numbers?
So we are seeing more cases statewide. When we look at the data from the Department of Health Services, we're at about 33,000 cases statewide, which is higher than what we've seen over the past 5 years. It could be that more people are out and having, just getting together. So that is one of the reasons that respiratory viruses spread. So there are simple steps that you can take to prevent getting the virus. Especially getting vaccinated is number one, but then number two, staying home when you're sick, making sure that you're coughing or sneezing into the sleeve of your arm or into a tissue, and making sure that you wash your hands frequently.
I think that a big thing that I know with myself, just kind of experiencing some of these symptoms earlier in the winter, the big question is this RSV, is this flu, is this COVID? And I think a lot of people, once they take that COVID test, they kind of go, okay, well, I'm in the clear because we're so used to not going to work when we have COVID. But is it important for people if they have something like the flu or RSV to also kind of practice the same things that they would if they had COVID?
Yes, it's really important that people stay home when they're sick. I think COVID taught us how important that was. Well, that same principle applies for all respiratory viruses. So if you have the flu or you've got COVID or you've got RSV, stay home until your symptoms reside and you are fever-free for 24 hours without taking a medication.
As far as when you need to know if you should go to the hospital, I know that we saw kind of an uptick here at the end of December of people in the hospital with RSV. And so they were kind of urging people, unless your symptoms are severe, don't go to the hospital. So when do you know when to make that call? When do you need medical treatment for something like the flu?
So normally flu or RSV is going to get better on its own. We recommend that if you're going to seek medical treatment, to do so at an urgent care, unless you have the following symptoms. So you are having difficulty breathing or shortness of breath. You have pain or pressure in your chest or in your stomach. If you're starting to feel dizzy or confused, or you've got persistent vomiting and you can't keep fluids down, or if you get flu-like symptoms that get better but then return.
And I think coming out of the holiday season, a lot of us kind of attribute sickness to, being with the family, those friends, large gatherings. But coming out of the holiday season, are the numbers kind of where they were in the months of November and December? Are we seeing kind of a downtrend as we head into February?
So we're starting to see a little bit of a downtrend in the data. And again, what I always say about influenza is that it's predictably unpredictable. December to March, February, March is usually our peak season here in Arizona for when we see cases. But we have seen cases all the way out until April or May some years. So you never know if it's going to resurge or we're going to see a different strain come into the community. So that's why we recommend it's never too late to get vaccinated. So if you haven't gotten vaccinated, now's a great time to do that.
Okay, so not out of the clear just yet.
Not out of the clear just yet, but the data is starting to trend down statewide.